The information provided in the following program is not a substitute for or intended to be medical advice. Medical advice can only be provided to you by your personal physician.
Another turning point, a fork stuck in the road. Time grabs you by the wrist, directs you where to go. So make the best of this test and don't ask why. It's not a question but a lesson learned in time. It's something unpredictable, but in the end is right. I hope you had the time of your life.
Good morning, everybody. This is Dr. Harry Schick from High Point Health Center in Highland Park, New Jersey. Glad to speak to you today, to our friends in Central Jersey. We also know from our last show that we reached Florida, North Carolina, Chicago, and Israel. So I just love the idea that we can spread good information around about healthcare. You know, I always think that healthcare is not the final goal of life. Healthcare is what we want you to have so that you can go live the life that you want to live. So we are, as usual, we're going to have 4 different segments. We're going to have 4 different topics so that we can introduce you to some different ideas. In between, during the week, I know I get calls and emails asking me to talk more about it, so you're always welcome to ask more information by reaching me at my office at 732-249-9800 on Facebook. I know we have people watching on Facebook now. And also emailing me at drschick317@gmail.com. And you're also, of course, welcome to call in here today right to the studio, 732-545-9282, 732-545-WCTC. So if you want to chime in or give an opinion or ask a question, we're always happy to hear what you have to say. So in our first segment today, we're going to talk about knee pain. And the reason I'm talking about knee pain, besides the fact that many, many people have it, and many people have it and think that there's nothing can be done, and I want to change that fallacy right away. But also, the way we understand knee pain, if we understand how knee pain works, we can also understand a lot of other things about the body. So when somebody comes in to me and they have knee pain, the first question is, where's their problem? Now, that may seem strange. Somebody comes in and says, my knee is killing me. Why would I say, where's the problem? And the reason is that knee pain may be a problem of the knee. It may be a problem from somewhere else in the body, or what usually happens is a combination of both. We seldom have a person who has had knee pain for more than a week or two that is only in the knee. And even if you think about it, that would make sense. If somebody has a knee problem, they're probably not walking the way that they normally would, so now they may wind up with a foot issue or a hip issue, even up to a neck issue. So we like to assess. I like to see exactly where things are coming from. One of my favorite things also when I get with people with knee pain, and if you've watched any of my 23andMe talks, you know one of my favorite ideas is that a person will come into me and say, my right knee is killing me, Doc, must be old age. So I always ask them, well, how old is your left knee? Because if it's only one knee, if it's only one area, it's not your age. There's something that has happened that is affecting that knee particularly. So what kind of things can that be? The other fallacy I get all the time is people telling me nothing can be done, which if you know me, you know I hate that. Somebody probably told them nothing can be done. They say, Doc, nothing can be done because it's knee on knee. So then I ask them to bend their knee. Just take their foot and bring their foot backwards towards their body. And I show them very clearly, if you can bend your knee in that way, it's not bone on bone. People who have bone on bone cannot bend that way. And I get very few people. There may be a part of it that's bone on bone, but there is a lot, believe me, a lot that can be done. So when we look at knee pain, we're looking at a number of different things. First of all, we're talking about inflammation in the joint itself. So if the knee is inflamed, listen, if your knee is inflamed, or any joint, your elbow, your hip, your foot, whatever, and that's the only part of the problem is that you have inflammation there, and you take an anti-inflammatory, you're going to feel great. I'm talking about you're going to be basically 100%. So if you have a knee pain or hip pain and elbow pain, whatever, you take an anti-inflammatory, that stuff should be like magic to you, and you're just great. But often it isn't. Sometimes people tell me that they've taken some anti-inflammatory, didn't help at all. Sometimes it helps them 50%. But if you have a problem that's inflamed and the problem is right there in the joint, the anti-inflammatory is going to make you feel great. When it doesn't, it's because at least part of the problem is coming from somewhere else. So when we're talking about knees, we have to think about where the nerve flow to the knee comes from. So if I ask you a question, where do you think the nerve flow to your knee comes from? Many people say, well, probably my lower back. If you've even thought about it at all, if you have an idea, you think, well, nerves from my back probably go to my knee. And that's true. But where do those nerves actually start from? They start from your neck. That's right. The nerves from your neck go down through your low back to your knee. So you can have a neck issue, you can have a low back issue, all contributing to your knee. And I want to tell you, even if you don't have any neck pain or you don't have any low back pain, those nerves going down to your knee can affect your knee and not hurt locally in your neck or low back. The other thing we see very often is that there are digestive issues that can affect your knee. Now, I know this sounds strange, and not just from being overweight, which is a big problem for the knee. We're going to talk about that in a little bit. But there are different reflexes in the body where organs actually affect different joints. Now, you're not going to hear this from conventional medicine, but then again, you're listening to the show because you're looking for more than that. So it's in an amazing map that we have of the body that shows that different organs affect different muscles. Now, you have a muscle behind your knee called the popliteus muscle. It's not a very big muscle, and most people have never heard of it, but it is a major stabilizer for your knee. So if you have a weakness in your popliteus muscle, your knee is going to be unstable and it's going to hurt. So why would you have a problem with your popliteus muscle? I'm going to give you the number one reason for that is a digestive issue, and the number one reason for that has to do with your gallbladder and maybe liver. So when somebody comes in, and particularly if it's the right knee, but could be either one, and they tell me my right knee hurts me on and off, there's nothing wrong with the knee, and it bothers them sometimes, one of the things I'm going to be asking them or looking at is whether there's a digestive component to it. And I have helped so many people with their knee problems only by helping them with their digestion, never touching their knee at all. It takes a little bit for them to give me a chance to do that because, of course, a person comes in with their mindset. If it's a knee problem, it must be in the knee. Now, that's not to say that it can't also come to the knee. Let's say a person had a gallbladder problem, affected their popliteus muscle. Now their knee is unstable. Ultimately, they're going to get inflammation in the knee. So we have to work on that also. And we have unique, unbelievable ways to help that. Two things many people have never even heard of. There's one machine called PEMF, Pulsed Electromagnetic Frequencies. This is electromagnets that we wrap around the knee joint, goes all the way into the cells of the knee, and is incredible at reducing knee inflammation. And we also have a newer technology we've been using. And in this technology, we've had two people who were scheduled for knee surgery just with this new technology who've canceled their knee surgery. And it's called microchip infrared technology. And using these microchips, which are computer-based lights, which we put on the knee, we had a person who could hardly bend their knee, and after half an hour of doing this, they were almost dancing around the office. So what's the upshot? What do you need to know about the knee or any joint issue? Number one, if it's been going on for any length of time, there's always going to be a secondary problem. And unless we fix everything, unless we fix the knee and we fix the alignment in the knee and we do the therapy for the knee, it's going to come back. And the second thing is don't give up. There are so many people who have come to us, even the two I just mentioned, on their way to surgery, who are told they need surgery or told they're just going to have to live with it, and we've helped them. There are answers for your joint pain, and particularly today we're talking about for your knee pain. I hope that was helpful. We're going to take a little break now, and we're going to come back, and we're going to talk about weight loss on the other side of the break. I'll see you very soon.
Sleepless nights, plenty of sleepless nights. Waking up in the middle of the night, can't go back to sleep.
Like when I first came back, it was kind of weird because like when I would be driving and a traffic light would go out or a light in the road would go out, that would kind of make me nervous because I'm thinking that at any second now something's going to explode.
I mean, death, destruction. I mean, that's something that stay with you, and it surfaces.
Normal reactions to an abnormal experience. Military life and combat trauma can have a lasting effect on your mental health. If you or a family member are having trouble coping, remember you're not alone. It takes courage to ask for help. An anonymous self-assessment is available online and by phone. Take the first step to healing. Visit militarymentalhealth.org or call 877-877-3647.
Join New Jersey General Assembly Speaker Craig Coughlin for Speak to the Speaker on WCTC, the second Friday of every month at 9 a.m. Speaker Coughlin discusses issues of critical interest to Central New Jersey, as well as the latest goings-on in Trenton politics and all of New Jersey. Speak to the Speaker with Assembly Speaker Craig Coughlin, and hosted by New Jersey Broadcasters Association Radio Hall of Famer Burt Barron. Only on 1450 WCTC.
It's something unpredictable, but in the end is right. I hope you had the time of your life.
Hi, thanks everybody for coming back after the break. This is Dr. Harry Schick. The show is Natural Health Consultant, and I'm very happy to have you here. We're going to be talking about everybody's favorite topic in the next segment. Again, if you have any questions, you want to call in, 732-545-9282. I hope you got a lot out of the information on knee pain, and now we're going to talk a little bit about weight loss. Can we really ever talk too much about weight loss? I don't think so. It's and as I've said before, I never know who's going to be interested. I have people who really should be interested who are not, and people who really don't need that much help. But this is for everybody, because increased weight is a tremendous problem for your knees, for everything, and also cosmetically, because we know that when people are happy with how they look, they feel better, they feel mentally better, and when they do that, it's good for everything. So last week we started talking about, I mentioned about the 3 food groups, and I go over this all the time. You know, there's only 3 food groups. There's carbohydrates, which includes complex carbohydrates like vegetables, all the way down to simple carbohydrates like sugar, and in between there's pasta and grains. There's protein, which can come from animal products, and there are also protein derivatives in grains and in beans. And then there's fat. Fat's the simple one. Fat is fat. Of course, that's not really true. There's vegetable fat and animal fat. So we have to be clear when we're talking about these things, which one we're talking about. So one of the things I tell people in terms of weight loss, because again, the key is talking about it's all hormonal, and we want to increase your fat burning hormones and decrease your fat storage hormones. That's the number one thing. Always keep that in mind with whatever we're doing. The bad news, unfortunately, is that a lot of the things that taste good are fat storage. So I tell a lot of people, they come in, they say to me immediately, all right, I know I shouldn't eat sugar. If I can't do it, what should I do? So the best thing is just to stop altogether, of course. And but if people want a gradient way of doing it, a step-by-step way of doing it, I tell them this. Look at your ingredients in what you're eating. Don't look at the sugar content, because even broccoli, if you look at sugar, has some sugar content to it. I'm talking about the ingredients label. So when you look at the ingredients label, my rule of 2 thumbs up, my rule of thumb is there should be no sugar, and there should be no sugar derivatives in the first 3 ingredients. So you think, okay, not bad. So if sugar is the 4th ingredient, the 15th, the 25th, whatever, okay, I'll give you, okay, have some of that. But if it's in the first 3 ingredients, avoid it. Now, it's not just going to say sugar. It could say brown sugar. Do you know what brown sugar is? It's white sugar that's been colored brown. Cane sugar, that means they removed it from the sugar cane. If it ends in a OSE, sucrose, fructose, glucose, any of those things, if it's in the first 3 ingredients, and especially high fructose corn syrup. Let me tell you about high fructose corn syrup. When you eat sugar in general, it goes to your body, gets broken down, and then gets reassembled as fat. Not so for high fructose corn syrup. which they also call HFCS, sometimes to not let you know it's there, so you have to go by the initials. It doesn't even get broken down by your body. It gets right to your liver and stored as fat. You have to avoid that stuff totally. So when you're looking at your label, if any of those things I mentioned is in the first 3 ingredients, the reason they're giving it to you is because it's to addict you to the sugar aspect of it. Avoid those and eat foods where, at the very least, wait till it's in the 4th ingredient. Now, the bad news is a lot of your favorite things, not only is it going to be the first ingredient, it might be the first and second, or it might be the first, second, and third. I've had people tell me, wow, the stuff I like to eat, I couldn't find anything but sugar until the 5th ingredient. Well, that should tell you something about it. The other thing I want to tell you, which I learned a long time ago about sugary things, is that I want you to chew them very well. I'm not going to name the bakery. There was a famous bakery that used to be on Route 1. I don't know if they're still there. And they had delicious food, delicious baked goods there. And I had many people who were addicted to them. So I told them, what I want you to do is to chew. You can have as many of their pastries or donuts or whatever as you want. That's right. I'm giving you carte blanche. You can have as many as you want. I only ask you one thing. Chew each bite 20 times. Okay? So I made deals with them. They took the sugary stuff. They chewed it 20 times. Every one of them came back to me and told me the same thing. The stuff is disgusting. Because after you chew it, the sugar comes out in the first 10 or 15 chews. But there is a bitterness and aftertaste that comes from all these things after about 15 bites. And people actually, that was one of the best things for them to do. I can't say that about all sugary products, but I suggest that you try it. Because there are other chemicals in there which are in there to get you addicted to the food. If you chew it enough, you will actually taste those, and you'll see how disgusting this stuff is. So the first 10 or 15 chews are to get your brain going, to get you addicted to the sugar. Listen, what do you want? You know, the old saying, you can't eat just one? I don't know. I think that might have been about a chip or something, not about a cookie. But, you know, I come from a long line of chocolate chip lovers. And you know, when I'm going to splurge, in the old days, I never do anymore. No, that's not true. But if I used to splurge, it would be chocolate chip cookies. Yeah, I was going to have just one. No way. So the box, as you know, probably some of you was shortly gone. By the way, my favorite things to snack on now, if I ever want to cheat, are carrot cake, which I absolutely love. I am actually one of the world experts on carrot cake. I think I probably had more than everybody listening put together over the years. And fruit tarts with that creamy middle. Those are my 2 personal favorites. So do I ever eat them? Yeah. Do I eat them often? No, because I can't find them. No, I can find them. I don't eat them often because that's not the way to do it. But nobody is saying you can't ever. But the thing is, you have to limit and chew. Those are the things that are important. So when we eat that stuff, because it's not really food, you know, one of my favorite lines is listen to this, there's no such thing as junk food. What? Yes, right. There's no such thing as junk food. It's either junk or it's food. So don't tell yourself I'm eating junk food. Just call it for what it is. So if I'm going to eat something that I quote unquote shouldn't be eating, it's junk. I may like it, but it's not food. Food, I don't want to disgrace the word food by calling that junk food. That's part of the vernacular or the language to get you to feel better about eating it. It's not. It's junk. So if you're going to have it, call it for what it is, minimize it, and chew it well so you can see it for what it's about. So that's the first 3 ingredients. Now, another thing that I want to tell you in terms of, and I mentioned this last time also, and I had many, many questions about this, was about fat. And I told people that in terms of sugar, fat, and carbohydrate, my favorite is fat, and probably eat more fat than the other stuff put together, because fat, besides being very good for you, fat does not put fat on you, right? This is, again, we have to understand the language of what's been done. Everybody grab a little of the excess around your belly right now. Go ahead. I'm not watching. Maybe some people are, but just kind of hold the excess around your belly. Now, you call that fat, right? They call it belly fat or whatever it is. You may touch yourself there and say, oh, I'm getting fat. I want you to stop that immediately. No longer are you going to call that fat because that demonizes fat. I want you to call that sugar. So I want you to touch your belly or wherever you've got a little excess and say, oh, I'm getting so sugar, right? Call it sugar because that's what it is. It's when you eat sugar, the sugar converts into fat. But by calling that stuff fat on your body, you make a connection with your brain that makes you afraid to eat fat, which is insane. There is no basis in any scientific literature that supports that. Everybody knows by this point that it's sugar that turns into fat. So touch yourself. When you call yourself, tell yourself, I am getting sugar. That will create an extra connection in your head that will hopefully keep you away from sugar. So I gave you a few things on that. The ingredients, and we talked about chewing it well, and I want you to change how you talk about the excess on your body. Okay, so, well, so much to talk about with weight loss, but just a little bit more. I want to tell you one of the traditionally over the years, I've always told people, there are different organ systems that relate to different kinds of fat deposition, where fat is deposed on different parts of your body. So I can pretty much look at somebody and see what their fat distribution is and tell them which organs are involved. There's a thyroid way, if the thyroid is sluggish, or there's ovary among the women, adrenal, and liver. As a matter of fact, I had a woman in the office the other day. She came in not because she was overweight, but she came in because she was allergic to soy. And we talked last week about what we do for that. But I saw that she had an incredible weight distribution. I almost wanted to take a picture of it. She was like the profile of overweight due to her liver. Now, an overweight liver has to do with a high top shelf. In other words, it's not a beer belly where the weight is low. In the abdomen, it's up high. So I saw that on her. Now, the good news about somebody who only has that is that is mostly water weight. There's a condition from the liver called ascites, A-S-C-I-T-E-S, which means a slow-functioning liver, which winds up creating a lot of high-shelf water. And I told her that if she did what I suggested to her, and I don't really like making predictions, but I felt confident, so I did it anyway. And I said, if you do what I'm telling you to do, make these small changes, it'll almost be like somebody sticking a pin in your upper abdomen, and you will watch that fat, which she thought it was fat, but I knew it was mostly water, just kind of melt away. So, and she did it for 2 weeks, and in 2 weeks, that upper shelf fat was gone 50%. And we didn't put her on any calories. I didn't even do the regular weight loss issue with her, just changing it and giving her liver support. And that ascites eased up. Her liver's doing better, which is always the main thing, and that fat went away. So depending on fat distribution, a lot of times is what we do. So the other issue is that we now have equipment in the office, which I never thought would actually work, but it does, which helps the body burn fat in specific areas. If you've been dealing with fat loss for a while, there's a chance that belly fat may be a big issue for you, because for a lot of reasons, which we'll talk about in future shows, that's one of the hardest areas to lose. And because that has to do with your adrenal glands, which has to do with stress and so forth. But we now have a piece of equipment in the office that actually targets weight loss to specific areas. And it's, in fact, the same microchip technology that I was mentioning on the earlier segment about knee pain. Wow, never enough time to talk about weight loss, but that's why I included it last week and this week, and I'm sure we'll get back to it again next week. So we're going to take a break in just a moment. This is Dr. Harry Schick, Natural Health Consultants on WCTC and on the Internet around the country, around the world. In a few moments, we're going to be joined by Honey Sturzer. We're going to talk about two very important issues. The next issue will be on brain health, and then before we go, even though it's only going to be 10:45 in the morning, at that point, we're going to talk about your sleep. So thanks for joining. We'll see you in about a minute and a half on the other side of the break.
Scam artists have been around forever, making promises that can't be kept. Everything from get rich quick to lose 30 pounds this week. Today, scammers are very sophisticated, taking advantage of homeowners facing foreclosure. If a so-called loan modification expert asks you for an upfront payment to fix your loan, run and run fast. Be aware of promises that can't be kept, like,
I guarantee to save your home.
We can significantly lower your mortgage payment.
We have a 97% success rate.
When it sounds too good to be true, it usually is. Learn how to protect yourself from foreclosure scams at www.hud.gov/fairhousing. Assistance from a HUD-approved housing counselor is your assurance that the information is trustworthy and free. Free. Now that's a word those loan modification scammers have never heard of. Find a HUD-approved housing counselor today at www.hud.gov/fairhousing.
A public service message from the U.S. Department of Housing and Urban Development in partnership with the National Fair Housing Alliance.
The new Talk Radio 1450 WCTC, the voice of Central Jersey. Ask the Doctor with Dr. Derek De Silva.
Hello, I'm Dr. Derek De Silva, host of Ask the Doctor. It's been 20 years for me right here on WCTC, and we've shared lots of great times together. I will continue to update you on the latest news from the world of medicine. So join me Saturday mornings right here.
The new Talk Radio 1450 WCTC, the voice of Central Jersey.
Something unpredictable, but in the end is right. I hope you had the time of your life.
All right. Welcome back after the break. On the radio, on Facebook, on the internet. It's an amazing technology that we have so many ways to connect. For those of you on Facebook, you saw me just taking a drink from my favorite Mountain Valley water. I want to, before we get into brain health, although this relates to brain health, I wanted to, first, I'm sorry. I want to say hi to Honey. Good morning.
Good morning. How are you, Dr. Schick?
I'm great, thank you. So Honey, as if you know from the past or from the office, holds down 1/3 of the office work, running the neurofeedback and therapy aspect. She's a licensed clinical social worker, a registered nurse, and nationally certified in neurofeedback, and a great help in many other ways too. So it's good to have you here, and I know you also like Mountain Valley water, right?
Yep, you got me hooked.
So I try to hook everybody on Mountain Valley water. Why? Because sometimes people say to me, Doc, I got great news. I just bought an alkalizer for my home, so now I can drink alkaline water. So I ask them if I say, I hope you didn't hook it up yet or unwrap it yet, because you should bring it right back to where you got it. Or they say, I'm buying special alkaline water. Don't waste your money. Let me explain to you very briefly about alkaline water. There are many studies that show that alkaline water, so we're talking about whether water is acidic or alkaline. There are many studies that show that alkaline water is connected with so many good health indicators. And it is. That's true. Mountain Valley water is high alkalinity. We see from the pH on the label. However, it is not the alkalinity that makes it healthy. It's the reason that it's alkaline that makes it healthy. So, alkaline water has a lot of tremendous mineral content. Those minerals make the water alkaline. But it's the minerals that are involved with your health, not the alkalinity. Alkalinity is a side fact to it. So people who get regular tap water spend a ton of money on an alkalizer and run it through and think they're getting health benefits. You're not. As a matter of fact, the proof that the alkalinity has nothing to do, as soon as you drink water and as soon as it hits your stomach, which is filled with stomach acid, there's no more alkalinity. The water gets neutralized the minute it hits your stomach. It's the minerals in the water that are the key. So if you're going to spend money on water, make sure it's high alkaline. And if you have questions, you can call or ask me about that. Okay, I like to get those little side facts in. So brain health. You know, when somebody goes to the doctor, they always, when they're done with the exam or whatever, they may say, okay, doc, tell me, how is my blood pressure? How is my cholesterol? How is this? How is that? But what they don't ask is, okay, doc, how is my brain? And really, if your brain's not working, don't worry about any of the other stuff. You're not going to have a good quality of life or much of a life anyway. So we like to actually talk about and look at the brain itself. And I know we have ways in the office of doing that. We'd mentioned before with the brain map. You want to explain what that is?
Oh, you're talking about supporting your brain with engaging in neurofeedback.
Right, but just the fact that we look at we actually look at the brain to see what's going on with the person.
Right.
We get a lot of nutritional information also. right? With a lot of nutritional information from the brain map as well.
Yeah, it's really interesting. So a brain map, we talked about this on an earlier show, but just for review, is a way to elicit information about how our brain is functioning by measuring and examining our brain waves. So we don't only talk about how the nerves or the neurons in the brain are working. We're actually looking at the electromagnetics of the brain in terms of brain waves. It's really
right. And I know sometimes you'll come to me. You'll say that you did a brain map, and you'll ask me if I have looked at, for example, the thyroid functioning of the person, because you can actually see things like that from the brain map itself. Is that right?
Yeah. So the brain map gives us clues in terms of our physiology, because if our thyroid isn't working the way it needs to, our brain isn't going to fire the way it needs to, and that will show up. There's a brainwave called alpha, which is a middle brainwave. It cycles at 8 to 12 cycles per second. So an adult should kind of cycle between 9.5 and 10.5. If someone has a thyroid problem, that cycling slows down, and we see that it looks like the brain is cycling in terms of alpha at 8.5.
And it's amazing to me how often we'll see on a brain map something which shows up exactly on the blood test as well. So what's going on in your brain, we know affects the whole body. So another example. If somebody breaks their hip, this is an example to show you the effect of the brain. Let's say somebody breaks their hip, an elderly person, much older than me, an elderly person breaks their hip. A lot of times people think, oh boy, this is going to be it, right? This is downhill from here. So let me ask you a question. Why would breaking your hip be such a major deal with your overall health in general? It doesn't make sense. It's a hip. It gets replaced. You put a new hip in. Why do we have this foreboding feeling that disaster is coming? And the reason is because when a person breaks their hip, what happens? They become immobile. They don't move around. And when they don't move around, what happens? The brain lacks stimulation. So it's not the hip. It's what the hip does in terms of creating a decrease of brain stimulation. So if I have somebody of any age, but particularly, if we're talking about somebody elderly and they break a bone, or it could be any bone, but they break their hip, we immediately begin talking about what kind of things that they can do to stimulate their brain, in lieu of the fact that they're not going to, at least temporarily, not being able to get that brain stimulation. And it makes a world of difference in their recovery, and it makes a world of difference in terms of how they function afterwards, because we've all seen people seeming like they just drop off a cliff into dementia, for example, after an injury like a broken hip. And it shouldn't happen, and it doesn't need to happen.
So just for clarification, not only is the brain directing us to walk, when we walk, there's information that the actual steps give back to the brain, which is what you're talking about with regard to not being ambulatory after you break a hip.
Right.
It's not getting the information from your lack of ability to walk around.
Right. We get it. Exactly. So we get a lot of people. We do a lot of work, for example, with something called peripheral neuropathy in the office. So one of the main things we find with people with peripheral neuropathy is that they lose the sense of vibration in their feet. So what I'll do is I'll take a tuning fork. I'll put a tuning fork to their feet. A lot of times they can barely feel the vibration coming from the tuning fork. That means that every time they're stepping on the ground, with every step they take, they're not getting the sensation they should. Every time you take a step and your foot hits the ground, there are nerves in the joints of your feet that should send signals that light up your brain. When you're not getting that, you're losing a tremendous amount of brain stimulation. I have people come in, for their brain stimulation, they're doing crossword puzzles. Maybe they're learning a foreign language. They're learning to play the piano, which is all wonderful, and I totally recommend you doing that. But it's going to get nowhere near the amount of stimulation to your brain as you're going to get if we can fix and make sure that you have proper vibration in your feet. As a matter of fact, anybody who comes to see me, if I haven't done it, I recommend have me check your feet. Let's see if you're actually getting the sense of vibration in your feet, because if you're not, it's going to ultimately affect your brain. So, right, not only does the brain affect what's going down in the body, but what we do in our body has to affect the brain as well.
So I'm just thinking about an exercise that you've had me do, and that I know that you suggest to other patients in the office. in terms of walking to stimulate the brain, taking a step with the left foot and swinging the right hand. Do you want to talk about that? Because I think
that's a good
people at home right now can actually try it out and see how challenging it is.
Right. So there's I call it a robot exercise. And if you can do it easily, it's not going to be any big deal to you. But there's a lot of people, this is going to seem like ultra-level calisthenics. What I want you to do is you're going to walk, and when you walk, you're going to bring your right arm up at the same point as your left leg. So your right arm swings forward as your left leg swings forward. And then the next step, your right leg goes forward with your left arm. So you're walking kind of like a robot. But the key is that your right arm and left leg, it's opposite. Your right arm and left leg are going to move together, and then your left arm and right leg are going to move together. And you're going to let your arms swing when you do that. And by doing that, you stimulate the whole brain. There's a particular, if you think about it, it's kind of like crawling, right, except you're walking. So one of the reasons that babies crawl is that it actually stimulates a part of the brain called the mesencephalon. It's the mid part of the brain. And that's a part of the brain. It's a major relay system between your body and your brain. So we want to make sure that continues to get stimulated. And by the way, I have patients for whom this is so hard. I actually have them down on all fours and re-crawling. And there's nothing wrong with that. Not in public and not down the street, but you might want to try it at home. Although I wouldn't mind seeing a video of it if you're doing it. But anyway, doing this is tremendously stimulating for the brain.
So if you have a hard time with it, then you recommend that you engage in this exercise a couple of times a day, a minute, 2 minutes?
Right. If it's hard for you, doing it for 30 seconds is going to seem like torture. So I recommend doing it short amounts of time, multiple times a day. So doing it for a minute, 6 times a day is better than 6 minutes once a day. And again, it's something that's very easy to do, and that you don't need any equipment. You just need a place to walk.
Right. I know many of us often go to the gym, make it a regular habit, and exercise their bodies, but which is great also for the brain. But actually staying at home and doing these exercises for your brain, the impact and the benefits are outstanding, and it's free.
Right. It's free, and it's also a great stress relief. Because if you're not good at it, you can't think about things that are stressing you while you're doing the walk. For example, if you're listening to today's politics, and I know today's going to be a very hot day in politics, while you're listening to the pros and cons of everything that's going on, do this exercise if you have a hard time. You'll get the information without the infuriation. It'll make it easier for you to just take it in without getting so tense. So again, right foot, left leg, left foot, right leg.
Right foot, left
I said that totally wrong. Right arm, left leg, left arm, right leg. I need to work on that. So that's a very simple exercise for you to do. And again, doing it multiple times instead of just once. And it goes along with one of my other favorite things to have people do, because I'm sure that's something different for you. The other thing is that I want you to, in addition to that, I want you to do something different. So when you, every morning, when you brush your teeth, let's say you're right-handed. You take the toothbrush in your right hand, you put the toothpaste on, and then you brush with your right hand. You are doing the same thing every day. Your right arm is doing a specific kind of an exercise, a fine motor exercise that's stimulating the exact same part of your brain every single day the way you've been doing it. Tomorrow morning, tonight, what I want you to do, when you put the toothpaste on the toothbrush, switch it. Put it in your left hand, brush with your left hand. That will be a totally different experience for your brain. And what we want is different pathways stimulated. If you're worried about your dental health at the end, you can go back and brush up on the right. But at least spend an amount of time with your left. The other thing you can do is fold your hands together. If you're on Facebook, you can see me doing it. Right thumb over right thumb, you're interclasping your fingers. Try doing it the other way, and it'll feel different to you also. There's many tips like this of doing things differently that we'll be talking about in the future. I see we're up against a break. We've got so much to go through. That's it for Brain Health for today. Stick around for the next minute and a half, and we're going to talk about you and your sleep patterns. Dr. Harry Schick, Natural Health Consultants with Honey Sturzer. See you soon.
I started using drugs when I was 13 years old. I started with pot, like most people probably do, alcohol, cigarettes, and eventually moved up to methamphetamine and went on to cocaine and eventually ended up on heroin.
I did not have a life. I mean, I owned a multi-million-dollar advertising firm, and I couldn't function.
My husband packed the children and left. I had no idea where they were. But none of that mattered. All that mattered was smoking crack.
And my parents, brother and sisters are just baffled. You know, how can somebody that supposedly has so much be so miserable and keep throwing his life away?
And I remember my mother saying to me one day, "You're going to die if you don't get help." I wanted to have my life back and my family back. And that's when my mother found Narconon.
If you or someone you love has a drug or alcohol problem, call Narconon today at 1-800-468-6933 or visit us at www.stopaddiction.com.
The new Talk Radio 1450 WCTC, the voice of Central Jersey. The Garden Show with Peggy Ballister-Howells.
Hi, I'm Peggy Ballister-Howells, host of The Garden Show. Whether it's planting seeds in the spring, battling summer insects, planting fall bulbs, or tending houseplants throughout the winter, there's always a way to play in the dirt. Share your garden adventures with us Sunday mornings from 8 to 10.
The new Talk Radio 1450 WCTC, the voice of Central Jersey.
It's something unpredictable, but in the end is right. I hope you have the time of your life.
Okay, welcome back. This is Dr. Harry Schick from High Point Health Center. Our number is number at the office is 732-249-9800. Feel free to call us or reach us on our website, highpointhealth.com. I'm here with Honey Sturzer. We're going to talk together during our last segment. If you have any questions, you can call in 545-9282. Thanks for everybody on Facebook and on the internet for listening in. And these are available also as podcasts if you want to share or let anybody know. You may have somebody specifically with weight problems or knee pain or something of that nature that you want to share some of the advice with. So the last thing we're going to talk about, which is a very stimulating topic, is sleep. So I want you to stay awake for this, and I want you to give this your full attention, because the sad truth is that if you don't sleep well, it's going to affect your health overall. Now, you know that if you don't get a good night's sleep, how it feels to you in terms of your overall energy. But it's much more than that. Your body does tremendous healing while you sleep. And I mentioned, I think, in the past that one of the major hormones that are involved with weight loss is called growth hormone. Growth hormone comes out at night. So if you're not sleeping, your growth hormone, which is involved with your weight loss, is not going to have a chance to have its full effect. You burn fat at night while you're sleeping if you have ample growth hormone. If you're not sleeping, you're not getting the growth hormone. And I have many people with stubborn weight loss, and one of the reasons they're not losing weight is because they're not sleeping. So we're going to talk about sleep. There are actually two kinds of sleep. There are many kinds of sleep problems. I personally like to break it down into two. There are those people who cannot fall asleep when they lie down at night. There are those people who fall asleep but then wake up during the night and can't get back to sleep. Two types of insomnia or sleep problems in general. And then there are those very, very unfortunate people who have both. They're tossing and turning in bed till 1 or 1:30 or 2 o'clock, and then they sleep for 1 hour, and then they're up for the rest of the night. And we work very hard on helping people with these problems because it just undermines everything in life. And I know you have, Honey, specific ideas and do a lot of work with people with sleep issues as well.
Yes, I do a full exploration in terms of sleep hygiene when anyone is interested in engaging in neurofeedback to help support their brains, because without adequate sleep, the brain can't function optimally. The brain is tired, and you can see that on maps. When we do a brain map to look at how the brain is firing, someone who has sleep depletion, their brain looks the map looks blue, meaning that it's very low energy.
How much sleep do you think a person should get at night, ideally?
I think it depends on an age, and there's you can actually go online and get the graph in terms of when you're a baby. You need a lot more sleep than when you're an adult.
That's interesting. Okay,
it would depend on your age.
But along with the quantity of sleep is the quality of sleep, and it's that breaking up of sleep that's very difficult for people. I know one of the reasons that people wake up during the night. There's really, from what I've seen, 90% of the people who wake up during the night. Well, yeah, say 90% of people wake up during the night. Not talking about those people who get up to go to the bathroom. That's a different issue, which we're going to talk to you about in future weeks. Actually, going to prevent a solution. For you, that if you do get up during the night to go to the bathroom, I'm going to tell you how we fix that in the office. But for most of the people who wake up just in general, it's due to either their digestion, because even though they may not have an upset stomach, digestive issues wake people up during the night. There's an incredible map of the body that shows different organs that work at different times of night. For example, I have people, not that unusually, will come in and say, Doc, I can sleep, but I wake up at 3:32 every morning. Isn't that strange? I mean, they look at their clock, it's the exact time. Or some people tell me it's between 2 and 3, but I particularly love the ones who tell me it's always the exact same time. So then I go to the organ map, and the organ map tells me which organs are functioning the highest at that particular time. And around 3 in the morning has a lot to do with the liver. So if a person is always waking up at the same time and having a hard time falling back to sleep, one of the things we do is simply support the organ that's most in effect or working the hardest at that time, and it's a tremendous help. It helps not only with their digestion during the day, but actually helps them sleep during the night. The other thing is blood sugar issues. So a lot of times what will happen is if the blood sugar issues are off, either too high or too low, the person will wake up startled via a mechanism that's involved with their adrenal glands. So it's very important for so many reasons, even including sleep. And I'll tell you one of the places I see this. I have people who come in and we do blood work on them, and their A1C, which is a measure of their general sugar level over 3 months, is fine, but their morning sugar level is high. Why is that? Because they're terrorized when they sleep. They either have too much stress, releasing adrenaline while they sleep, or their blood sugar level is so far off that they actually wake themselves up. So, in this case, it's a mechanism for their body to actually help themselves. The body becomes terrified when the blood sugar goes too far off and they can't get through the night. So in looking at this, we look at digestion and we look at blood sugar, and there's also issues of what we call sleep hygiene that we look at to help people. You want to tell us a little bit about that?
Yeah, so just to kind of clarify that what you're saying is that physiologically, if something is off with regard to hormones or with regard to the blood sugar, that will trigger some kind of fear. So the person wakes up anxious.
Exactly.
Or if a person is struggling with anxiety and their blood sugar is normal and that anxiety is coming to play while they're sleeping, they'll wake up with a jolt in the morning or in the middle of the night and feel really anxious. So it makes sense to really come in and get a full workup to see, is there one contributor to the sleep issue, or is it coming from multiple directions, both physiological and psychological?
Right. Many times we have to work on it in a number of different ways, but there's nothing better than seeing a patient come in. I ask them how they're doing, and they say, well, I've been getting a good night's sleep, and I know that that's affecting everything with their overall health. I mean, again, you know it yourself. If you have the problem of not being able to sleep, you know what it's like of trying to get a good night's sleep. But there's many things we can do at night to get through the sleep better. So I know you've talked to people about some ideas.
Right. So part of the questionnaire includes what do you do with your electronics? How soon before you go to sleep are you on your phone, or are you watching TV, or on your iPads? That's a really important question. What do you do to unwind at night? Sleep just doesn't happen. Sleep is something that you actually have to work on in terms of supporting it for you to have good sleep.
Right, and it's not just playing an intense video game before bed, which of course can be a recipe for disaster, but it's also just the electromagnetic frequencies themselves that some people are sensitive to that make it difficult to fall asleep.
Absolutely, and let's not forget about the importance of melatonin in terms of sleep. Do you want to comment on how melatonin helps us sleep?
Right, so melatonin is very involved with melatonin is a hormone that's produced in the brain, and it's involved with your sleep cycle. So there's a certain rhythm by which you should be awake, and then a rhythm by which you should fall asleep. And if your melatonin is off, it has many, many effects. I know a lot of you have heard of melatonin. Some of you may have tried it and taken it, and we always recommend that if you do it, let us know, because sometimes there are other things that get affected by taking melatonin. Remember, it is a hormone. It's interesting that you can just go into any store and buy a hormone, but I was shocked when I found out that it was not regulated, but people can just go in and buy it. Melatonin is also very involved with serotonin, which we know is a brain chemical that has to do with people feeling relaxed or reduced anxiety.
Right. So the eyes have a lot to do with the production of melatonin. And when you're looking at a screen, that the light that's coming in from the screen is going to interfere with the whole process of melatonin production, which happens in the evening and helps you have a really good quality sleep. So a really good recommendation is, if you can, an hour and a half before bed, and if you can't, work your way backwards to get to at least an hour before you going to sleep, to shut off all your electronics. And if you want to listen to music, an iPod is good. Read a book. Practice some of that breathing that we talked about
right. The breathing, very important.
In one of our last shows. And really, really put yourself into the place where you can just unwind, spool down, relax, and move into sleep.
Right. Some people, I talk to them about their sleep habits, and they work like crazy, and then they go home, they clean up, they do all this stuff, and they expect to just plop down in bed and be right to sleep. Right. Now, I know some people, I myself being one of them, are very fortunate that way. I can pretty much fall asleep wherever at work, standing. I actually did that once. I was up all night for a reason, and then I actually I was holding a book, and I fell asleep when the book hit the ground. The sound of the book hitting the ground woke me up while I was standing, which I'm glad it did. But I don't have that problem. But I know that for a lot of people, sometimes it's, again, what they're doing right before bed, worrying, stress before bed. I mean, it's common sense, but these are things people forget about doing. And I got one question that came in on Facebook related to having a hard time falling asleep. I remember a long time ago, sometimes you hear something years ago and it just sticks with you. And it was about calcium phosphorus ratio. That calcium, if you think about animals that eat a lot of calcium, cattle, they're kind of slow and sluggish, and they don't look. I have a hard time picturing a cow as an insomniac. They look like they could pretty much fall asleep, much like me at any given time. However, if you think about a Kentucky racehorse, which the grass in Kentucky is very high in phosphorus. Phosphorus is like the accelerator on the car, whereas calcium is like the brake. So a lot of times people have a problem where they're taking things in with phosphorus, for example, or don't have enough magnesium before sleep. And these are simple things that can be looked at that we can do. So again, there's no way to cover the whole sleep issue in one time, but I'd like to bring in different segments, and these are things that we'll go back to in the future. So if you have questions, you can always call us. We like to have questions. You can reach us on Facebook. So many great ways to reach us through our website. You can even use a telephone and call via email, which we've talked about before. The key thing is that I want to share is that doing things for health takes a little bit of work and a little bit of time. And I know people come in sometimes and they expect, after 20 years of a specific kind of habit, they expect that their health is going to change. So it's work, but it's worth it. You are worth it. It is worth it for you, for yourself, and for us to help you. And please let us know. Thanks for listening today. We look forward to next week. We're going to have 4 new great topics. This is Dr. Harry Schick.